Hey everyone, ready for another deep dive?
Always excited to learn something new.
Well, today we're going deep into the world of the heart and the kidneys.
Two of the body's heavy hitters.
Exactly. We often think of them separately, but they're actually super interconnected.
Yeah, more than people realize, for sure.
So we're going to unpack this whole heart-kidney connection thing, focusing specifically on a condition called cardiorenal syndrome.
Or CRS for short.
CRS, yeah. You gave us a couple of really interesting research papers to dig into.
Yeah, I thought these were particularly relevant.
The first one is Syndrome Cardiorenal Nephrologia al Dia, which is basically a recent overview of the condition.
It's a pretty comprehensive look at the current understanding of CRS.
And the second paper is Syndrome Cardiorenal Aspectos Clínicos y Ecocardiográficos.
Which dives more into the clinical and the echocardiographic side of things.
Right, the more technical aspects. So our mission today is to figure out how heart problems and kidney problems can be linked and what that means for, well, your health.
And your family's health. It's something that can impact everyone.
Right, absolutely. So let's start with the basics. What exactly is cardiorenal syndrome or CRS? Why should we even care about this?
So CRS is kind of like it's an umbrella term. It describes any situation where you have a problem in either the heart or the kidneys, and that problem triggers an issue in the other organ.
Okay, so it's not just one organ failing. It's like a domino effect.
Yeah, exactly. Like they're constantly influencing each other.
And it can get pretty serious, right? I mean, when these two vital organs are out of sync.
Oh, absolutely. It can have a huge impact on your overall health, especially your recovery from either heart or kidney problems.
The research mentions that there are different types of CRS. Like, it's not just one thing.
You got it. There are 5 main types of CRS, each with its own kind of unique mechanism.
Okay, 5 types. All right, let's break those down. I don't want to get lost in all the medical jargon.
Yeah, no, totally. The first type is called acute cardiorenal syndrome.
Acute cardiorenal syndrome.
This one's the most important when we're talking about urgent patient care. Think of it like a sudden traffic jam. You've got a heart problem, like a heart attack, and that suddenly reduces blood flow to the kidneys.
Oh, okay. So the kidneys aren't getting enough blood.
Oh, right. And because of that, they can't filter waste properly and everything starts to back up.
Like a clogged drain.
Yeah, exactly.
But that's the acute, the sudden version. Yeah. What about the long-term effect? Is there a chronic version of this?
There is. We call that chronic cardiorenal syndrome.
Okay, so that's the traffic jam, but it's happening over time.
Yeah, it's more like a leaky faucet. It's slowly damaging the foundation of your house. You have a heart issue, like heart failure, that gradually over time weakens the kidneys.
Got it. So those are the 2 types where the heart issue comes first. What about when the kidneys are the main problem?
Well, then we're looking at types 3 and 4.
Okay.
Type 3 is acute renocardial syndrome.
Acute renocardial syndrome. So now the kidney's the problem.
Right. Think of it like a sudden power outage in a city. Everything's disrupted. Hospitals can't function properly.
Chaos.
Exactly. It's like that when a sudden kidney issue, like a severe infection, messes with the heart's ability to function properly.
That sounds pretty intense.
Yeah, it can be.
Yeah.
Then we have type 4, which is chronic renocardial syndrome.
Chronic renocardial syndrome.
This one's more like a slow decline, like a garden slowly withering away without enough water, long-term kidney disease gradually affecting the heart.
Oh, that's good visual. Okay, so we've got the traffic jam, the leaky faucet, the power outage, and the withering garden. What about that 5th type?
Right. Type 5 is a little different. It's called secondary cardiorenal syndrome.
Secondary cardiorenal syndrome.
And this is when another condition, like diabetes, is affecting both the heart and the kidneys at the same time, like a storm that damages both the house and the garden.
Okay, so both organs are taking a hit because of something else going on.
Yeah, exactly.
Wow, those analogies are super helpful. I'm already starting to get a better grasp on this whole CRS thing. You mentioned earlier that type 1 CRS, the traffic jam scenario, is especially important for patients in acute care. Can you explain why that is?
Yeah. During a heart event, like a heart attack, your body's doing everything it can to try and compensate, right? But sometimes those compensation mechanisms can backfire and actually harm the kidneys.
So the body's trying to fix the heart, but it might accidentally hurt the kidneys in the process.
Exactly. It's a delicate balance.
The research mentions some pretty complex terms like hemodynamic changes and neurohormonal activation. Can you break those down for us?
Sure. Hemodynamic changes are like the immediate impact on blood flow. The heart's not pumping as effectively, so less blood gets to the kidneys. Those tiny filters in your kidneys, the glomeruli, they aren't getting enough blood to do their job properly.
So the cleaning system's getting compromised.
Right, and then you have neurohormonal activation. It's like your body sounding the alarm. It senses trouble and tries to increase blood pressure and hold on to more fluid.
Trying to get more blood pumping, I guess.
Exactly. The problem is, those responses, they can put a lot of stress on both the heart and the kidneys, making things worse. Imagine trying to cram more cars onto an already jammed highway.
Not a good situation. So we've got reduced blood flow, we've got this overzealous compensation system, and the research also talks about inflammation, right?
Yeah, inflammation is a key player here. The body's natural response to injury can actually contribute to both heart and kidney damage if it gets out of control.
So it's like the body's trying to heal itself, but it's going a little overboard.
Exactly. And there's another interesting factor that comes into play: your gut health. When blood flow to the intestines decreases, it can actually lead to bacteria leaking into the bloodstream, which further fuels that inflammation.
Wow. I never thought my gut would be involved in all this.
Mm.
So how common is type 1 CRS? I mean, this all sounds pretty serious.
It is serious, and it's more common than you might think. Studies show it occurs in about 27–45% of heart failure patients.
Wow, that's a pretty significant number. And those consequences, they can be pretty severe, right? Longer hospital stays, more complications down the line.
Absolutely. It can really impact long-term heart and kidney health. That's why early detection and intervention are so important. Welcome back, everyone.
All right, so last time we left off talking about type 1 cardiorenal syndrome, that traffic jam situation that can happen when the heart's not pumping enough blood to the kidneys.
Right. We talked about how a heart attack or heart failure can really put a strain on the kidneys, and how sometimes the body's own attempts to fix things can actually make things worse.
Yeah, the body trying to help, but kind of messing things up in the process.
Yeah.
But how do doctors even know if someone has type 1 CRS? Like, what are the signs?
So there are a few key ways that doctors can diagnose this condition, and one of the most important tools is something called echocardiography.
Echocardiography. That sounds pretty intense.
It might sound complicated, but it's actually a pretty simple procedure. Echocardiography, or echo for short, uses sound waves to create images of your heart. It's basically like sonar for your heart.
Oh, interesting. So it gives doctors a way to see what's going on in there.
Exactly. And it's painless, totally non-invasive.
So it's like a live video of your heart in action.
Pretty much. It lets doctors see how well your heart is pumping and how much blood is being sent out to the rest of your body, including, the kidneys.
Right. So if the echo shows that blood flow is sluggish, that's a red flag that the kidneys might not be getting what they need.
Exactly. And it's not just about measuring the blood flow. The echo can also show structural changes in the heart that are often linked to kidney problems.
Oh, interesting. Like what kind of structural changes?
Well, for example, it can show if the walls of your heart are thicker than they should be. That can happen when your heart is working extra hard trying to compensate for kidney issues.
Okay, so the echo can actually give doctors a pretty good picture of what's happening with both the heart and the kidneys. You mentioned that echo is one of the key diagnostic tools. What are some of the other ways that doctors diagnose type 1 CRS?
Well, besides the echo, doctors look at blood tests and urine tests. They check for things like creatinine levels.
Creatinine levels.
Yeah, it's a waste product that healthy kidneys filter out. So if your creatinine levels are high, that could be a sign that your kidneys aren't working as well as they should be. They also check your urine output. If you're not producing enough urine, that could also point to kidney problems.
Okay, so they're looking for clues in your blood and urine that can tell them how well your kidneys are functioning. What if those tests don't really show anything conclusive? Are there any other tools doctors can use?
Yeah, there are some newer tools that doctors are starting to use. Remember we touched on those biomarkers earlier?
Biomarkers, right.
Those are like little molecules in your blood or urine that can signal very early signs of kidney damage.
So it's like they're giving doctors a sneak peek at what might be going on.
Exactly. They're like smoke detectors, picking up on even the tiniest trace of smoke before there's a full-blown fire.
That's a great analogy. So these biomarkers can help catch kidney problems super early, even before traditional tests might show a problem.
Right, and the earlier you can detect kidney damage, the better the chances of preventing further damage. And it's not just about diagnosis either. These tools, the echo, blood tests, biomarkers, they can all be used to monitor your progress and see how well treatment is working.
So it's like having regular checkups for your heart and kidneys, making sure everything is running smoothly.
Yeah, exactly. You want to stay on top of things.
All right, so we're back for the final part of our deep dive into the fascinating world of the heart and kidneys.
Fascinating and vital, I'd say.
Absolutely. So far, we've explored the different types of cardiorenal syndrome
Right, especially that traffic jam scenario of type 1 CRS.
and how doctors use tools like echocardiography, blood tests, and biomarkers to diagnose it.
All crucial for understanding what's going on.
But now let's shift gears and talk about what you can actually do to protect these two vital organs.
Because knowledge is power, right?
Exactly. Knowing is half the battle. So what practical steps can people take to manage CRS or even prevent it in the first place?
Well, first off, understanding your risk factors is huge. Things like diabetes, high blood pressure, any history of heart problems, those can all increase your risk for CRS.
So if you have any of those conditions, managing them properly is key.
Absolutely. It's like building a strong foundation. You got to make sure you're following your doctor's recommendations, taking your meds as prescribed, making those healthy lifestyle choices.
Right, taking care of the basics. But what about prevention? Are there things people can do to lower their risk, even if they don't have those underlying conditions?
For sure. Remember we talked about certain medications that can put extra stress on your kidneys?
Like those NSAIDs, the common over-the-counter pain relievers.
Yeah, those. And the contrast dyes used in some imaging procedures.
Right. So being mindful of those things.
Exactly. If you need pain relief, talk to your doctor about safer alternatives. And always make sure your doctor knows about any kidney issues you might have, especially before a procedure involving contrast dyes.
Being proactive and communicating openly.
Absolutely. And this might seem obvious, but if you experience any symptoms that could signal heart or kidney trouble,
Don't ignore them.
right, things like shortness of breath, chest pain, any changes in your urination,
Swelling, unexplained fatigue.
all red flags. Don't wait. Get medical attention right away.
It's like listening to your body and trusting your instincts. Early detection is key.
Couldn't agree more. So we've talked about medications and being aware of potential risks, but what about lifestyle changes? Can those really make a difference in managing or even preventing CRS?
That's a great question. Everyone wants that magic bullet.
Well, the good news is healthy lifestyle choices are some of the most powerful tools you have.
Okay, I'm all ears. What are the most impactful things people can do?
It's probably not going to surprise you. Maintain a healthy weight, eat a balanced diet, low sodium, low saturated fat, get regular exercise, and of course, no smoking.
Those are the golden rules, right?
They are. They might seem simple, but their impact is huge. We're talking about protecting both your heart and your kidneys.
It's about making those healthy choices a regular part of your life.
Exactly. It's not a sprint, it's a marathon. Sustainable changes make all the difference.
All great advice. But I know it can feel really overwhelming if you or someone you love has just been diagnosed with type 1 CRS. Any advice for navigating those emotions? It can be a lot to process.
Absolutely. First of all, remember, you're not alone in this. Reach out to your support system, your family, friends, support groups, anyone who can offer emotional support and help you manage those practical challenges.
So important to lean on your loved ones. What about those days when the worry and stress just feel like too much?
Finding healthy ways to manage stress is crucial. Meditation, yoga, spending time in nature, listening to music, talking to a therapist. Whatever works for you, make it a regular part of your routine.
It's about taking care of your whole self, the mental and emotional side, as much as the physical.
You got it. And here's something I always tell my patients. Don't be afraid to ask questions. Your healthcare team is there to support you every step of the way.
Asking questions can really make you feel more in control.
Absolutely. Ask about the specific type of CRS you have, the causes, the treatment options. Ask about the risks and benefits of medications. Don't hesitate to inquire about lifestyle changes that can help you manage your condition.
Knowledge is power, and asking questions can help you feel empowered to make the best decisions for your health.
Exactly. And remember, while CRS is a serious condition, there's always hope. By understanding this connection between your heart and your kidneys, by being proactive, by working closely with your healthcare team, you can really take control of your health destiny.
Beautifully said. A huge thank you to our expert for walking us through this complex but super important topic.
My pleasure. Always happy to share what I know.
And to all of you listening, thanks for joining us on this deep dive into the heart-kidney connection. We hope you feel informed and empowered to take charge of your health. Keep exploring, keep learning, and keep taking care of yourselves.